This video will demonstrate a splint delivery on the epoxy models for the D2 occlusion class. Everybody has pre-mounted the mandibular model by hand articulation, and here is a close-up of the splint before it's adjusted onto a mounted articulator. A splint was originally made by a conventional laboratory technique on these models, and it was then digitally scanned and rendered into software, and it was printed by Whitmix so that all models would have the same identical splint. This is additive printing, and it is the future. Here's the finished product. You'll see that there are red dots in the posterior and in the anterior, and there's green lines. That's our finished goal. Each of those dots represent a cusp. There are 2 for the mandibular buccal cusps, 2 for the mandibular first molar buccal cusps, 1 dot for each buccal cusp of the mandibular premolar, and then all 6 of the anterior teeth, canine forward, have red dot contact. And then we also show the excursions. First thing you'll do is you'll take your splint and you'll try it on your model. Some will be a little snugger than others, but most of them will be just perfectly fitting. As you try it on, you're just seeing if it goes up all the way. Carefully push it on, see if there's any rocks. Look at it and see if you can see through the plastic to see that it's completely seated. If it feels loose, then a little bit of sticky wax can be put along that second molar, first and second molar areas onto the model to hold it down. Here are the movements that you'll be doing as you adjust this. You can open and close it from the top. It can be locked in the back at this point, or you can turn it upside down with it locked in the back as well, and you can open and close that way. You're going to be checking excursions towards the end. And so you'll hold the guide pin and you'll go to the right and you'll go to the left. And you'll also work out protrusive movement. You'll see you can just push and use the guide pin to help you move the articulator. So then you're going to put it on and you're going to get your red wax. And the first thing you're going to do is see how many contacts are there. So you're going to put it on, you're going to tap it, just twice is enough. 2 times again, make sure the incisal guide pin is not holding open the articulator and that it is closing into the splint. And then you're going to take it off and you're going to have a look at it. You're going to see what your starting point is. And you'll see there'll be, 5 or 6 marks. Then you'll take your low speed and your acrylic burr and you'll start to reduce away the marks. Now, if you take away the mark exactly the same amount on all of them, then the next time those that were there should come back plus more. You notice that I'm going slowly, and often there's little indentations you have to work through, because when they make this, they make it out of wax. They close the articulator and the opposing cusp indents. So when you're in the back, you want to do it flat, but then when you get to the canine forward area, you want to go at an angle because you need that later on to create your anterior guidance. So once you take away the marks the first time, you do it again. You put the tape back in, tap a couple times, all the way around, take it off and have another look. And you'll see that hopefully you have a few more. Start to pick up some in the anterior, start to pick up some on the left side, and so you do it again. You take it off in your hand, and you take your handpiece, and if you're in the back, you go flat until it just disappears. Go slowly. It'll cut pretty quick. When you're in the anterior, go at an angle because you need to have a forward ramp so that when you go into protrusive, your posterior teeth will separate. Do it till they just disappear. Flat in the back and slightly angled in the front. You see, I'll go through it several times. And you notice that right now I'm on a lingual mandibular cusp. Whenever you have that, you can be more aggressive because you don't want the lingual cusp to touch, only the buccal. You're going to do this several times. Again, put the tape in, tap a few times, take it off, have a look, and you'll see that it doesn't look a whole lot better yet. Got to be patient. Just got to keep working at it. A little bit later, it gets a little closer. So you start again shaping flat on the back until they just disappear. And do them all the same, and then they'll all come back. If you do it harder on one, then you'll lose it, and it'll take a while to get it back again. In the anterior, only touch where the marks are, because you don't want to take away the area that's not touching yet. And put an angle in the front. In the back, flat on the back, till they just disappear. There. There you see in the video, I'm just barely touching it until it just disappears. Then you put it back on the articulator and you tap it again. Have another look. See how close you're getting, and this might take 30 times. It can be a little frustrating, but hang in there. Notice the left side isn't coming together yet. Starting to pick up some of the anterior. The size on the right is good. A little bit later, we're getting a little bit contact now on the left. Notice that they're all getting to be kind of the same size. A little bit more contact is forming on the left. A few more in the front we have to get. Keep going. Just be patient. Work it out slowly. They're starting to show up. And here we are. We're getting real close. Here we are. Got our finish now. So notice that I have 6 on each side in the posterior and all the anterior teeth. So now they're all there. So now we check protrusive. And we go forward and we notice that they're not all touching on the edge. So you put the tape in and you go forward. And when you do the protrusive movement, you only take away forward to your occlusal contact in centric. You don't take away that final dot. See, you just take away what is there forward to your centric holding points that you already established. There you go. Didn't take these away, only the lines forward. And only on the lines, and then you keep this up over and over until finally you start to get full even contact on all 6 of the anterior teeth. And if you need to, you can turn it into lines by just leaving the middle and taking away the sides. Until finally you have forward, and notice the canines have a V shape to them. The V is the right lateral, and then the protrusive both. And then what you want to do is you want to thin it down and start to shape it up, just like you would if this was going in the mouth. You want it to be smooth, and you don't want to have any rough edges. And you want it so that when the lip rests against it, it's comfortable and it's not thick and bulky. And so you're working around all the perimeter. And then you're working away on the inside too. You notice it's a little thick in this lingual area right here. You don't need this now. It always starts a little thick there because you don't know to what point the contact has to make contact there. So you start to thin it down as much as you can to make it comfortable. And then you'll finish up with some pumice. And you'll pumice it up until it's nice and smooth and shiny. You can take it off in your hand and smooth it up. Now when you put the pumice on it, make sure you get the wheel wet and the pumice in a paste, and make sure you don't be aggressive on the occlusal surfaces because you don't want to lose these contacts. You want the contacts to stay so that we can see them. Work it around until it feels good to your fingers and smooth. I'd like to finish by having us look at the canines on the protrusive and right and left lateral. Notice that the canines have a V shape. The forward line is part of protrusion, of which it shares with the other 4 incisors, and the other part of the V is right and left lateral. We want these things adjusted so that only the canine has contact along in a skinny line into right and left lateral, and no bouncing, working, or any other contact present.